If you are over the age of 60, I want you to visualize a scenario that is becoming terrifyingly common in emergency rooms. You sit down for a dinner that looks perfect on paper. A fresh salad, maybe some steamed broccoli, perhaps a side of corn. You go to bed feeling proud of your discipline. You have avoided the fried foods, the sugars, and the red meats. But by 3 a.m. something feels wrong. You wake up dizzy. Your arm feels heavy, like it doesn't belong to you. Your speech is slightly slurred. You assume this is just fatigue, but it is actually a physiological alarm bells ringing. Most people assume stroke triggers are always obvious villains, like greasy burgers or salty fries. But here is the shocking medical truth that we are only now beginning to fully understand. Sometimes the trigger is a vegetable you thought was your best friend. A food you have been told for 40 years is heart-healthy can, after age 60, quietly raise your stroke risk overnight. Why does this happen? It is not because the vegetable has changed. It is because you have changed. Foods that acted as fuel when you were 40 can backfire when you are 70. This is due to 3 critical aging factors: a decline in glomerular filtration rate, how fast your kidneys filter toxins, the stiffening of arterial walls, arteriosclerosis, and the complex interactions with common medications like blood thinners and beta blockers. When you combine specific vegetables with these aging factors at the wrong time of day, you create a perfect storm for a cerebrovascular event. In today's comprehensive guide, we are not just listing foods, we are explaining the biochemistry of 9 common vegetables that can quietly increase stroke risk if you are over 60. More importantly, we will teach you the chronobiological protocol, exactly when and how to eat them safely so they remain medicine, not poison. Please watch until the end, because the #1 vegetable is a dietary staple for almost every senior, and it carries a hidden inflammatory risk that mimics stroke symptoms perfectly. Let's start with spinach, the oxalate trap. Let's begin with a vegetable that is practically synonymous with health: spinach. For decades, nutritionists have praised spinach as a superfood, packed with iron, magnesium, and essential antioxidants. However, after age 60, this leafy green can quietly shift from a vascular protector to a vascular restrictor if consumed incorrectly. The mechanism here involves a compound called oxalates. Spinach is incredibly high in naturally occurring oxalates. In a younger, hydrated body with optimal kidney function, these oxalates are filtered out through urine without issue. However, the aging kidney filters blood more slowly. When a senior consumes high amounts of spinach, especially at dinner when hydration levels drop, these oxalates remain in the bloodstream longer. Here is where the danger lies. Many seniors are also taking calcium supplements or vitamin D for bone health. When high levels of oxalates meet high levels of calcium in the blood, they bind together to form microscopic calcium oxalate crystals. These are not just kidney stones. These microcrystals can accumulate and narrow the small capillaries that feed the brain, acting like sand clogging a fine mesh pipe. This narrowing reduces cerebral blood flow, hypoperfusion. If the blood flow drops too low while you sleep, it can trigger a silent ischemic event or a mini-stroke overnight. Consider the case of Elias, a 74-year-old gentleman. He started drinking raw spinach smoothies every night to boost his iron. Instead of feeling energetic, he began experiencing nightly dizziness and brain fog. His doctor realized the oxalate load was stressing his kidneys and circulation. The solution is not to banish spinach, but to respect the biology of aging. First, always cook your spinach. Steaming or boiling reduces oxalate levels significantly compared to raw spinach. Second, consume it at breakfast or lunch, when your metabolic rate and hydration are at their peak. Third, avoid taking your calcium supplement at the exact same meal as your spinach. By separating them, you prevent the crystal formation, that threatens your small blood vessels. Next on our list is broccoli, the coagulation conflict. Next, we must discuss the king of vegetables, broccoli. This cruciferous vegetable is rightfully famous for its fiber and cancer-fighting properties. However, for the millions of seniors managing atrial fibrillation or history of clots, broccoli presents a serious pharmacological conflict. The issue is vitamin K. Broccoli is one of the most potent sources of vitamin K1 on the planet. Vitamin K is the biological key that turns on the clotting mechanism in your blood. If you are bleeding from a wound, you would want high vitamin K. But many seniors are on anticoagulants, blood thinners, like warfarin, Coumadin, Plavix, or even daily aspirin regimen. These drugs work specifically by blocking vitamin K to keep the blood thin and prevent strokes. When you eat a large bowl of broccoli, you are flooding your system with the exact nutrient your medication is trying to block. This can cause your INR, International Normalized Ratio, the measure of how fast your blood clots, to drop dangerously low. This makes your blood thicker than your doctor intends, dramatically raising the risk of a clot forming in the heart and traveling to the brain. The danger here is not the broccoli itself, but inconsistency. Take Margaret, a 68-year-old patient. She would go weeks without broccoli, then buy a huge bag and eat it for dinner 4 days in a row. This binge behavior caused her medication to stop working effectively, leading to a hypertensive spike. To eat broccoli safely after 60, you must follow the rule of consistency. Do not surprise your blood. If you eat a cup of broccoli 3 times a week, keep doing exactly that. Do not suddenly stop, and do not suddenly double it. Your doctor creates your medication dosage based on your consistent vitamin K intake. By keeping your diet steady, you keep your stroke risk low. Next on our list is romaine lettuce. The hydration paradox, vegetable number 7, is a staple of the light senior dinner. Romaine lettuce. You might think a salad is the safest possible dinner choice, low-calorie, light on the stomach. But eating water-rich greens like romaine late in the evening can trigger a specific nocturnal stroke risk known as hemoconcentration. Romaine lettuce has a mild diuretic effect due to its high water and mineral content. It encourages the kidneys to flush water. For a younger person, this is fine. But for a senior, whose thirst mechanism is already blunted, this leads to nighttime dehydration. When you lose water while you sleep, your blood volume decreases, but the number of red blood cells stays the same. This makes your blood thicker and more viscous, like turning wine into ketchup. Thick blood moves sluggishly through stiff, aging arteries. This sluggish flow is the perfect breeding ground for a thrombus, clot, to form, typically in the early hours of the morning when your blood pressure naturally rises, the morning surge. Consider James, a 72-year-old who ate a large Caesar salad every night at 7 p.m. to lose weight. He would wake up multiple times to use the bathroom, further dehydrating himself, and wake up with a pounding headache, a sign of poor perfusion. The protocol for romaine is timing. Shift your salads to lunch. This allows your body to utilize the hydration during your active hours. If you must have greens at dinner, pair them with a dedicated glass of water to counteract the diuretic effect and keep your blood viscosity safe while you sleep. Next vegetable on our list is raw carrots, the glycemic spike. Number 6 challenges the idea of the perfect snack. Raw carrots. We love them for their crunch and beta-carotene. But for the post-60 metabolic system, raw carrots consumed in isolation at night can be a metabolic disruptor. Carrots are a root vegetable with a higher glycemic index than leafy greens. When eaten raw and on an empty stomach, they digest rapidly, releasing a quick surge of glucose into the bloodstream. In a younger body, insulin handles this instantly. But many seniors have insulin resistance or prediabetes. This sugar spike is followed by a reactive crash later in the night. When your blood sugar crashes while you sleep, nocturnal hypoglycemia, your brain panics. It signals the adrenal glands to release cortisol and adrenaline to wake you up or mobilize stored sugar. These are stress hormones. They constrict your blood vessels and drive up your blood pressure exactly when it should be lowest. This seesaw of blood sugar and blood pressure damages the delicate endothelial lining of your brain's blood vessels over time. Eleanor, age 75, used to snack on baby carrots while watching TV at 9 p.m. She suffered from insomnia and morning palpitations. Once she stopped the late-night raw carrots, her sleep and morning blood pressure stabilized. The fix is pairing. Never eat raw carrots naked after 60. Always coat that carbohydrate with a fat or protein. Dip them in hummus. Eat them with a handful of walnuts or have them with yogurt. This slows the gastric emptying, flattening the glucose curve and preventing the overnight stress hormone release. Let's now talk about garlic. The double blood thinner, vegetable number 5, is nature's antibiotic. Garlic. Garlic is powerful medicine. It contains allicin, which naturally lowers blood pressure and thins the blood. However, after 60, there is a fine line between healthy blood flow and hemorrhagic risk. The risk profile changes because so many seniors are on a cocktail of heart medications. If you are taking warfarin, clopidogrel, Plavix, or a daily baby aspirin, your blood is already chemically thinned. Adding high amounts of garlic, especially raw garlic or concentrated garlic supplements, amplifies this effect. It's a synergistic reaction. Instead of preventing a clot, you risk making the blood too thin. This makes the delicate vessels in the brain susceptible to leaking or bursting, known as a hemorrhagic stroke. It also increases the risk of internal bleeding from minor falls or bumps. Robert, age 79, started taking aged garlic extract pills on top of his prescribed blood thinners. He began noticing large, unexplained bruises on his arms and frequent nosebleeds. These were warning signs that his clotting factors were dangerously low. The rule for garlic is culinary, not supplemental. Cook with garlic cloves in your food. The heat deactivates some of the most potent blood-thinning enzymes while keeping the flavor and antioxidants. Avoid raw garlic shots or high-dose pills unless your cardiologist specifically coordinates it with your medication. Next on the list is onions, the hypotensive dip. Closely related to garlic is vegetable number 4, onions. Onions are rich in quercetin, a flavonoid that relaxes blood vessels, vasodilation, and lowers blood pressure. While this sounds beneficial, it can be hazardous for seniors who are already managing hypertension with medication. Here is the scenario. You take your blood pressure medication in the evening. You then eat a dinner heavy in onions, perhaps a French onion soup or a stir-fry. Both the drug and the onions work to lower your pressure simultaneously. This can lead to nocturnal hypotension, where blood pressure drops too low while you sleep. When pressure drops too low, the brain doesn't get enough oxygenated blood, hypoperfusion. This is a leading cause of silent strokes or transient ischemic attacks, TIAs. Furthermore, if you get up to use the bathroom at 2 a.m., this low pressure can cause orthostatic hypotension, a sudden dizziness that leads to falls and head trauma. Linda, age 66, experienced frequent dizziness upon standing. Her diet was heavy in raw onions. Once she cooked her onions, reducing the potency of the vasoactive compounds, and reduced the portion size at dinner, her dizzy spells resolved. Use onions as a flavor enhancer, not the main course, and be mindful if you are on potent beta blockers or ACE inhibitors. Let's now discuss corn, the starch, disguised as a vegetable. Number 3 is a comfort food favorite: corn. Whether it is corn on the cob, grits, or creamed corn, it feels wholesome. But physiologically, after age 60, corn behaves less like a vegetable and more like a high-glycemic starch, similar to white bread. Corn triggers a rapid conversion of starch into glucose. For a senior with slower insulin sensitivity, this creates immediate inflammation. High blood glucose rusts the blood vessels, a process called glycation. Sticky, sugar-coated proteins damage the lining of the arteries, making them stiffer and more prone to plaque buildup. Furthermore, the spike and crash cycle of glucose creates physiological stress overnight, thickening the blood and increasing the workload on the heart. William, age 70, loved a bowl of corn chowder for dinner. He didn't realize this was spiking his blood sugar to pre-diabetic levels every night, contributing to his creeping hypertension. The chronobiological protocol for corn is strict. Eat it at lunch, never at dinner. Always eat it on the cob rather than as processed flakes or grits, as the fiber structure in the whole kernel slows down digestion slightly. And crucially, pair it with a healthy fat or protein to blunt the insulin spike. Treat corn as an occasional treat, not a daily vegetable serving. Next is asparagus, the diuretic drain. Vegetable number 2 is the elegant asparagus. Often seen as the pinnacle of a clean diet, asparagus is a powerful natural diuretic due to the amino acid asparagine. For a senior, fluid balance is delicate. We lose our ability to retain electrolytes as we age. When you consume asparagus, especially at dinner, you accelerate fluid loss through urination. This does 2 things. First, it dehydrates you, thickening the blood and increasing clot risk as discussed with romaine lettuce. Second, and more specifically, it can flush out potassium and magnesium, electrolytes that keep your heart rhythm steady. An electrolyte imbalance in the middle of the night can trigger arrhythmias, such as atrial fibrillation. Atrial fibrillation is the leading cause of embolic strokes, where a clot forms in the fluttering heart and travels to the brain. Patricia, age 77, noticed that on nights she had asparagus, she had leg cramps and heart palpitations. These were signs of mineral depletion. The solution? Eat asparagus at lunch. And for every spear of asparagus you eat, match it with hydration. Drink water, or eat water-rich foods like cucumber. If you are on prescription diuretics, water pills, be extremely cautious with asparagus, as the double effect can drop your blood pressure and hydration dangerously low. And the final one is tomatoes, the inflammatory mimic. We finally reach the number 1 vegetable that requires caution after 60, tomatoes. This kitchen staple belongs to the nightshade family, Solanaceae. While rich in lycopene, tomatoes contain compounds like solanine, histamines, and tyramines. For many seniors, the gut lining becomes more permeable with age, leaky gut. These inflammatory compounds can leak into the bloodstream, triggering widespread systemic inflammation. This inflammation can cause blood vessels to constrict or dilate unpredictably. Even more alarming, these compounds can mimic neurological symptoms. Seniors with sensitivity to nightshades often report brain fog, migraines, dizziness, and joint pain that feels eerily similar to the early warning signs of a stroke. This can lead to panic and unnecessary ER visits, or conversely, desensitization where a real stroke is ignored because it's just the food. Additionally, the high acidity of tomatoes can disrupt the body's pH balance and deplete calcium and magnesium stores, leading to nerve signaling issues. Thomas, age 73, suffered from chronic joint pain and nightly acid reflux that mimicked chest pain. He ate tomato-based pasta sauce almost daily. By reducing his tomato intake and switching to olive oil-based sauces, His stroke-like dizziness and inflammation vanished. To eat tomatoes safely. Cook them thoroughly. Heat breaks down some of the solanine and makes the heart-healthy lycopene more absorbable. Avoid raw tomatoes in salads at dinner. Pair them with magnesium-rich foods like spinach or pumpkin seeds to counteract the acidity. After hearing this list, you might feel a sense of betrayal. We have been conditioned to believe that vegetables are always good. And they are. But the context changes as we age. Your body at 60 plus is a different biological machine than it was at 30. Your filtration is slower, your vessels are stiffer, and your blood chemistry is more delicate. It is not just about what you eat, but when you eat it and how it interacts with your medications. Spinach and asparagus belong at lunch, not dinner. Broccoli requires consistency to keep your blood thinners working. Garlic and onions should be cooked, not raw, to prevent bleeding risks or hypotension. Carrots and corn need protein partners to stop sugar spikes. This is not about restriction, it is about precision. By making these small chronobiological adjustments, you turn these foods back into powerful allies for your longevity. I would love to hear from you in the comments. Which of these vegetables is a staple in your diet? And will you be changing the time of day you eat it based on this information? Your experience could help another senior navigate their health journey. If you found this deep dive helpful, please like this video and subscribe to our channel. We are dedicated to providing the detailed, science-backed health information that seniors deserve. Remember, what you put on your plate today becomes the clarity, strength, and independence you carry into tomorrow. Stay sharp, stay safe, and stay vital.